Menieres disease. Menieres disease is a disorder of the inner ear, and this causes severe dizziness, which is vertigo, ringing in the ear, which is tinnitus, hearing loss, and a feeling of fullness or congestion in the ear. Menieres disease usually affects only one ear. This is the hearing loss pattern, and if you will observe, the hearing loss is in the low frequencies. If you see 125, 250, 500, 1000, it is in the low frequencies. Attacks of dizziness may come on suddenly or after a short period of tinnitus or muffled hearing. The usual pattern is initially the patient has a feeling of blocking or closing of the ear, a feeling of tinnitus, and as it fades off, a terrible attack of vertigo. Some people will have single attacks of dizziness separated by long periods of time. Others may experience many attacks closer together over a number of days. Some people with Menieres have vertigo so extreme that they lose their balance and fall. These episodes are called drop attacks. Menieres can develop at any age. It is more likely to happen in adults between 40 and 60 years of age. The National Institute on Deafness and Other Communicable Disorders, NIDCD, estimates that approximately 615,000 individuals in the United States are currently diagnosed with Menieres and that 45,000 cases are newly diagnosed every year. The symptoms of Menieres disease are caused by the buildup of fluid in the compartments of the inner ear called the labyrinth. The labyrinth contains the organs of balance, namely the semicircular canals and otolith organs, and of hearing, that is the cochlea. It has two sections, the bony labyrinth and the membranous labyrinth. The membranous labyrinth is filled with a fluid called endolymph that, in the balance organs, stimulates receptors as the body moves. The receptors then send signals to the brain about the body's position and movement. In the cochlea, fluid is compressed in response to sound vibrations. This stimulates sensory cells that send signals to the brain. In Menieres disease, the endolymph builds up in the labyrinth, interfering with the normal balance and hearing signals between the inner ear and the brain. This abnormality causes vertigo and other symptoms of Menieres disease. This is the inner ear. This is the endolymphatic sac, the semicircular canals that look after balance, and the cochlea that looks after the hearing. And if you observe, if the fluid fills up in this entire structure, this backup of fluid leads to swelling and pressure. The swelling in the semicircular canal distorts balance information, and the swelling in the cochlea distorts sound information. The entire thing fills with fluid and gets distorted. This is the labyrinth in relation to the ear. The labyrinth is composed of semicircular canals, the otolith organ, which is the utricle and the saccule, the utricle and the saccule, and the cochlea inside their walls, which is a bony labyrinth. They are thin, pliable tubes, and the sacs, namely the membranous labyrinth, is filled with endolymph. Many theories exist about what happens to cause Menieres disease, but no definite answers are available. Some researchers think that Menieres is the result of constrictions in blood vessels similar to those that cause migraine headaches. Others think Menieres disease could be a consequence of viral infections, allergies, or autoimmune reactions. Because Meniere's disease appears to run in families, it could also be the result of genetic variations that cause abnormalities in the volume or regulation of endolymph fluid. Meniere's disease is most often diagnosed and treated by an otolaryngologist. However, there is no definite diagnostic test or a single symptom that a doctor can use to make the diagnosis. The diagnosis is based on medical history and the presence of two or more episodes of vertigo lasting at least 20 minutes each, tinnitus, temporary hearing loss, and a feeling of fullness in the ear. Some doctors will perform a hearing test to establish the extent of hearing loss caused by Meniere's disease. To rule out other diseases, a doctor might also request MRI, CT scans of the brain. Meniere's disease does not have a cure, but the doctor might recommend some treatments which we will highlight to help a person cope with the condition. Medications. The most disabling symptom of an attack of Meniere's is dizziness, and therefore, prescription drugs like meclizine, lorazepam can relieve dizziness and shorten an attack. Salt restriction and diuretics. Limited dietary salt and taking diuretics help people control dizziness by reducing the amount of fluid the body retains, and this may help lower fluid volume and pressure in the inner ear. Other dietary and behavioral changes. Some people claim that caffeine, chocolate, and alcohol make their symptoms worse and either avoid or limit them in their diet. Not smoking also may help lessen the symptoms. Cognitive therapy. Cognitive therapy is a type of talk therapy that helps people focus on how they interpret and react to life experiences. And some people find that cognitive therapy helps them to cope better with the unexpected nature of attacks and reduces their anxiety and future attacks. This is a picture of gentamicin injection. Gentamicin is injected and to use its ototoxic action to reduce the volume of fluid. How does gentamicin work? Gentamicin, when injected through the eardrum into the middle ear, percolates or diffuses via the round window into the inner ear, and this destroys the dark cells which are instrumental in fluid formation. Pulse pressure treatment. The US Food and Drug Administration, the FDA, has approved a device for Meniere's disease that fits into the outer ear and delivers intermittent air pressure pulses to the middle ear. The air pressure pulses appear to act on endolymphatic fluid to prevent dizziness. This is the pulse pressure Menieres device. Low pressure pulse pressures transmitted to the round window via a grommet displaces the endolymph, relieve endolymphatic eye drops, and this is to be used for about 5 minutes 3 times a day. That is the endolymphatic sac. Surgery. Surgery may be recommended when all other treatments have failed to relieve dizziness. Some surgical procedures are performed on the endolymphatic sac to decompress it. Another possible surgery is to cut the vestibular nerve, blocking the flow of impulses, but now it is of less usage. This, therefore, is a comprehensive overview of Menieres disease.